Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation. Today we are very fortunate to have a conversation with Doug Bahn. He will bring us his announcement about accepting Medicare and respond to a question about focal cryotherapy. So let's go now to Dr. Doug Bahn.
Good morning, Dr. Barken. I would like to take this opportunity to inform you that I have made my decision to accept Medicare as of January 2013. It has been my experience that many Medicare patients in my practice have financial shortfalls, which limits proper and timely office visits and evaluation. Recently, I have received many phone calls and also emails from patients imploring me to accept Medicare. The economy does not seem to be getting better anytime soon. Please spread my decision to your patients and followers. Thank you very much for your continuous support.
Dr. Bahn, I would like you to know that your announcement about accepting Medicare insurance made many patients very happy. In my support group, the patients were very excited about having the opportunity again to continue and get transrectal ultrasound color Doppler for following their prostate cancer disease under active surveillance, and also to be able to have the expert on cryosurgery take care of them either focally or totally. And their main question was, and I'm transmitting that question to you, is what is the situation up to date in regards to active surveillance and the indication for focal cryotherapy? What is your latest experience? Thank you, Dr. Bahn.
Dr. Barkin, thank you for the question.
You are welcome.
If someone is undergoing active surveillance, that means they have either low risk or intermediate risk disease. Interestingly, we just finished reviewing 250 patients who went on active surveillance management in my own practice. This abstract will be presented at AUA meeting in May in San Diego. The median follow-up was about 5 years. The rate of continuing active surveillance in 2 years was 97%. The rate of continuing active surveillance in 5 years was 75%. No patient's death was shown, and no patient developed metastasis during that time. The main reason for opting out the active surveillance management option was, number one, psychological burden. That means they felt all of a sudden that it was not comfortable to staying on active surveillance, and they thought they have to do something more definite. Next, the reason was clinical evidence of disease progression. That means elevating PSA mainly. The third reason was pathological evidence of disease progression. That means the follow-up biopsy showed evidence of disease progression, mainly upgrading the glycine grade. So as long as the cancer is seen in only one lobe, mainly right or left lobe, focal cryoablation would be a good option. That is a kind of middle line approach between active surveillance and radical options such as radiation therapy or surgery. Based on my data that was published many times in the literature, it showed equal or better oncologic outcome, but it shows much better result in preservation of quality of life issue, mainly urinary continence and sexual function. So any more questions, I'll be happy to answer the questions. Thank you very much.
Thank you, Dr. Bahn. And if you have any questions, you could write to us at info@pcrev.org, or you could call us at 619-906-4700, or some of you may get an email with a reply button at the end. You could click and even send your question by video. Thank you, Dr. Bahn. Thank you to our listener. Stay well, stay informed, and have fun. And here is the contact information for Dr. Doug Bahn. Take care. Goodbye.